All right, guys, thank you so much for listening to us in our channel, Ageless Body Clinic. It's a continuation of the subject, weight loss and peptides. And while you're here, you should leave and close the door. Let's talk about the longevity of using the peptides. When semaglutide came out, shut up!
Okay, bye guys.
When semaglutide came out, which is the GLP-1 agonist, right? Or antagonist? What is
I
it?
think it's agonist.
Agonist. So GLP-1 agonist. A lot of people were excited, but at the same time scared, and at the same time, it's like how long they can be on it. Since it was a diabetic drug, so people with diabetes can be on it chronically.
Yeah.
But the dose is different. So a lot of functional medicine doctors came out with protocols called microdosing. So being on microdose, you can actually be on it for a long time. You can be a chronic user to reset your metabolism and to curb your appetite. But by the way, when you're on GLP-1 longer than 6 months, your appetite is not curbed anymore. But people don't even realize that they actually start eating a lot less than before because they form the habit.
Yeah,
and their stomach is shrunk, and hopefully their habits are
changed
now, and they know how to do control of the portions. So I've seen the patients who lost a lot of weight, but they were on maximum dose, and they experienced a lot of side effects. And the main one was nausea and constipation. So on microdosing, you don't experience nausea. And what is microdose? So if it's a 100 unit syringe, microdose is less than 50 units. So you can be on less than 50 units for a long, long time, and then you don't have to inject yourself once a week. You can do it once in 2 weeks or once in 3 weeks. So everyone is different. So when you come to the clinic, we can discuss that. What's the regimen of your injections? Some people stay on 10, 15 units all the time, and that works for them very well. And I'm not talking only about semaglutide, I'm talking about semaglutide or tirzepatide. So to answer your question, can you chronically use it? Yes, you can. But again, blood test every 3 to 4 months, measurement of your visceral fat, your muscle mass, your water weight should be at least bi-weekly, or maximum once a month, just to see if you are regulating all these findings. And a lot of people claim that their anti-inflammatory factors went down and they become actually perfect on their labs, so with the chronic use of the GLP-1 or GIP-1.
So it's well established that losing weight, right, will lower your insulin resistance. You will lower your blood pressure. It will lower your risk of heart disease.
Yes.
Right. So that just by the fact that you're decreasing the weight, losing that fat, which also harbors material that could be pro-inflammatory, you're lowering the inflammation markers in the body. So I think it's a great combination. That it's not just I want to lose weight because I want to look good. It's actually you want your body to be healthier, and you can do that.
And obviously you cannot forget about supplements. Because you are eating less, you still need good quality food that, as we know, that our food is not as rich in vitamins and minerals now as before. So you have to use supplements as help to make sure that you're getting enough protein, that you're getting enough fiber, that you're getting enough of minerals. Some people experience cramping in their calf muscles. Again, it's a sign that you're missing magnesium or electrolytes. So you cannot ignore those. Even if you are like how you look in the mirror, if you're experiencing those type of symptoms, it's not because of the injection. It's because your life with injection.
True.
So it's, to answer the question, can I be on it for a long time? Yes, you can, but making sure that your lab values and other factors are in check.
So yeah, so once the lifestyle changes, right, and we've already addressed why the person has weight problems. I mean, if it's hormonal and we give the proper support, they probably may not need it after they reach the weight that they wanted. So not everyone will need to be maintained on it long term. Some will not. That's why it's very individual, and it's not a cookie cutter. That's why you need to come see medical professionals, get help and assessment, so we know, like, it's an ongoing conversation. After the 6 months, we see where you are, what were the reasons for your increased food intake. If it was mental problems, and we've already addressed that, and you see yourself not binging on food or not having an unhealthy relationship with food, then you will graduate probably from taking the medication. But if you have a body that is prone to like postmenopause, right, the metabolic rate changes, the new tire around the waist, that's not going to go away. Maybe it will get better with hormone replacement therapy, maybe not. You might be a candidate of continuing on it on a microdose, which is not going to have the side effect of it, but you continue to benefit from its effect. It's important to understand that these drugs are really good with controlling your sugar. So people who are pre-diabetic, this is perfect for them. And usually pre-diabetics are placed on something like glucophage or one of these peptides for life, because it protects them from getting diabetes. So there's also that element, which is also beneficial.
Let's talk about, as you know, Ozempic face. A lot of women lost weight, but looking at the face, they definitely looked older, and nobody wants to look older.
No.
So what do you do in the cases like that? That's a huge sign of that you're not getting enough protein and you're not getting enough exercise. And with face, you can do exercises as well. I know it's much harder. Face yoga is one of the things that you can do at home. But there are tools, the professional tools, such as electrical muscle stimulation for the face. We actually do it here in the clinic. And there are a lot of home devices as well that you can place electrodes on the muscles of the face and stimulate it on a daily basis. You don't lose so much facial volume on tirzepatide or retatrutide, but on Ozempic, the semaglutide you do, but there are ways of how to prevent it. So don't ignore it. Don't wait until your face becomes saggy. Be proactive and do the electrical muscle stimulation and all other facial exercises to maintain the muscles.
And also, there are peptides that are specifically that, like other kinds of peptides, that when we give with these weight loss peptides, right, they preserve the integrity of the skin.
Yes.
Like which one?
Yes, so the GHK copper, it's an amazing peptide that actually, some people say that, when they start using the peptide of GHK copper, they stop doing the neurotoxins injections, because it does prevent wrinkles, it improves the elasticity of the skin, it makes the color of the skin a lot glowy. So yes, it's an amazing peptide that you can actually combine with GLP-1 to preserve the skin health.
So there are many ways to optimize the work of these weight loss peptides and to protect from any unwanted effects like the semaglutide phase, Ozempic phase. So a combination of muscle stimulation and lymph drainage and exercising and the proper peptides and supplements will work very well with these weight loss medications to get the good results of weight loss while maintaining the health of the body and the integrity of the skin.
Some people that started using, chronically using the peptides for weight loss, they experiencing the mood disorders. Okay, and that's a big factor nowadays. People do experience mood swings and anxieties and depressions without even peptides. So can the peptides actually make it worse? And some studies show that they can. So again, microdosing will not affect your moods, number one. Number two, you got to talk to us about the supplementation or using other peptides that actually improve the moods. There are tools, again, going into mental health, how to control your emotions, and how to do some sort of relaxation techniques that make your mood a lot more better and stable. So peptides, they're amazing, but they can cause negative side effects if you don't use it correctly, or if you overuse without having enough knowledge. So talk to us, write to us. We would be happy to answer your questions, your comments. If you have negative reactions, maybe you should give yourself another try with someone else who can show you the positive aspect of this. So just we wish you good luck, and we wish you amazing weight loss journey. And see you later.